So good day, dear students. Hello, my name is Sir Mark, and I'll be your lab preceptor for this particular course, which is clinical bacteriology. Now, for this day, or for today, what we're going to discuss is something that's quite unique to the bacteriology laboratory in terms of laboratory safety. Because in other sections in the laboratory, you don't usually see this. Okay, see this machine, okay? So it's usually found lang in the microbiology or bacteriology laboratory. And this is what we call your biological safety cabinet. Now, again, you have already had a previous lecture, yeah? The one I lectured on laboratory safety, that's general, okay? And this is just an additional, okay? And this is again based from Mahon, which is again your main reference textbook, and also some information from Bailey and Scott's. Okay? Alright. So again, what we're going to talk about are biological safety cabinets and biosafety levels. Now, why did I particularly choose this? Because I believe especially you students who are just beginning with the bacteriology course might confuse the two terms with each other and might think that they're the same, when in fact they are not the same, okay? So again, these are your biological safety cabinets and biosafety levels, okay? Alright, so of course, first we're going to talk about the definitions. Okay, so what is a biological safety cabinet and what is a biosafety level? Alright, now we start with your biosafety cabinets or your biological safety cabinets. Now, your biosafety cabinets are kinds of equipment, a hood, okay? A hood that are a type of containment barrier that protects the worker from aerosolized transmission of organisms. Okay, so again, the main purpose of your biological safety cabinet is to prevent, okay, to prevent the workers and also the environment from being contaminated by the organisms that they are processing. Okay, so example, mag-process ka og kanang sputum, of course, which can result to some aerosolized substances, okay, that might infect the worker and also the environment. That's why it's best that you do it under a biosafety cabinet. Because again, it protects the environment as well as the worker from aerosolized transmission of organisms. Okay, so that's the main job or main function of a biological safety cabinet or biosafety cabinet, BSCs. Whereas, in comparison, a biosafety level or BSLs are levels of containment. So levels of containment meaning each level has its own microbiological procedures, guidelines, and facility and equipment that needs to be followed so that again to protect and to prevent any infections or any diseases from processing these specimens. Again, these are your biosafety levels. So again, levels of containment, each biosafety levels have different example organisms which they consider as BSL 1, 2, 3, or 4. Okay? So again, that's just the main difference between BSCs and BSLs. BSCs are again your biosafety cabinet. These are equipment that are used in the laboratory, again, to protect the worker from aerosolized transmission and also the environment as well, okay? And lastly, biosafety levels are levels of containment, okay? So each level has a different microbiological guideline, a different facility that needs to be done or that needs to be used, okay? But most of the time, usually, kung unsay biosafety level, mo po yung gamiton na BSC. Example, if BSL 1, ang gamiton mo na BSC is BSC 1. If BSL 2, ang organism, mo gamit mo kang BSC 2, but that's not all the case all the time. Because BSL 3 and 4, which are the highest na gyud na mga BSLs, ang atong gamito na cabinet ana or BSC is BSC 3, which is the highest na pod of BSCs na mga classes. Okay? So again, most of the time, kung unsa na BSL, mupoy, kung unsa na level sa BSL, mupoy BSC na gamiton. Okay? Alright. So again, that's the difference between biosafety cabinets and biosafety levels. Alright. Now we start with your biosafety cabinets, okay. Of course, again, biosafety cabinets have three major classes. You have your class 1, class 2, and class 3. Now, according to Mahon, again, which is your main reference for bacteriology, there are three major classes. Again, class 1, class 2, class 3. But according to Bishop, which is your book in clinical chemistry or CC, there's different subclasses under class 1, class 2. And from previous board exams daw, dito mga manguha ang board of examiners of questions na BSCs sa Bishop na mga subclasses, okay? But since bacteriology man will focus on the three major classes. And I'll just show to you a tabularized form of the Bishop na version sa mga biosafety cabinets for you to familiarize yourselves with. Okay? Alright. So again, we'll start first with your Bsc 1. Okay, so your Bsc 1 is the most simple and most of the basic, most basic rather, BSCs. Okay? So ang point lang sa Bsc 1 is that it allows unsterilized air. So meaning room air ra gyud na wala gi-sterilized. Musulod ra siya dayon aning variable sash opening. Okay? So ang air musulod and then dira na sa paggawa sa air dito pa siya i-filter or i-sterilize using a Hepa filter. Or what's the meaning of Hepa? High efficiency particulate air filter. Now Hepa filter can also be found in your N95 na mga masks. Okay? Your Hepa filter filters organisms that are greater than 0.3 micrometers. Okay? So your Hepa filter, again, filters microorganisms with a size of greater than 0.3 micrometers. So as you can see, micrometers man eh. Therefore, most of the time, dili po niya ma-filter ang viruses, if I'm not mistaken. Okay? So again, it filters organisms that are greater than 0.3 micrometers. That's your Hepa filter. Okay? So, alright. So again, that's for your Bsc 1. Again, it uses a Hepa filter. It allows unsterilized air. Unsterilized air, ha? So, it's not sterile. Okay? So, room air na dirty. And then, ang difference lang is sa paggawa sa air, after na magamit within the Bsc, dito na siya i-filter. Okay? Ayan. Alright. So, that's for Bsc 1. And usually, ang ginagamit na mga kani mga Bsc 1, ginagamit niyo siya for organisms na BSL 1 or Biosafety Level 1. So, kato mga organisms that are not known to cause any infection, BSL 1. Ang ginagamit nato na Biosafety Cabinet is Class 1. Okay. That's for Bsc 1. Next, we go now to your Bsc 2. Okay. Or Biosafety Cabinet Class 2. Okay. Alright. So, the Bsc Class 2 is the most common na mga biosafety cabinets sa microbiology laboratories. Now, the difference between Bsc 1 and Bsc 2 is that in Bsc 2, ang air na pasulod padaan sa imuhang cabinet, gina-sterilize na siya through a Hepa filter. Okay? Diba? Recall, ang Bsc 1, dili na niya i-sterilize ang air na pasulod. Whereas, kanina sa Bsc 2, mo-sterilize na siya ang air daan sa pasulod. And then, of course, ang air po na pagawas, yung i-sterilize through Hepa filter. Okay. And the Bsc Class 2 is also known as your vertical laminar airflow. Okay? So, vertical laminar airflow. Ang air na naa sa sulod, kabantay mo ang opening, right? Variable sash opening. Mo-form siya og sheets. Okay? Sheets. Okay? So, in a way, these sheets, they protect the workers also by serving as barriers to particles from outside the cabinet. Okay? So, again, vertical laminar airflow, right? And the air inside forms sheets. Okay? Sheets. Okay. Again, ang difference lang dyan sa Bsc Class 1 and Class 2, ang Class 1, mo allow na siya unsterilized air pasulod, and then yan ang i-sterilize pagawas padulong sa environment. Whereas ang Bsc Class 2, ang air daan na pasulod is gina-sterilize na through Hepa filter, and also again, ang imuhang air pagawas gina-sterilize po using Hepa filter. So again, that's for Bsc Class 2, most common dyan na ginagamit in microbiology laboratories, and you're also known as your vertical laminar air flow. Okay. And the last type of Bsc is known as your Bsc Class 3. Okay. Your Biosafety Cabinet Class 3. Now, your Bsc Class 3, it provides the highest level of protection. Why? Because it's self-contained. Dili na siya mukhang air outside. No, the air is just within the cabinet lang yun. And kabantay mo wala na opening here. Di para sa Bsc 1 and 2 na naa. Ang naa diri is gloves na daan. So what you do is imo ra isulod tong imong hands sa gloves and then mag-process na kasi mo specimens inside. Okay, not unlike sa Bsc 1 and 2 na open lang siya, na musulod pa yung kamot, then mag-gloves ka or what. Kanina, anay gloves daan yun. Okay, again, why? Because these cabinets are used for processing specimens na organisms that are highly contagious. So, example, mga viruses, you have ka na mga exotic na mga viruses na kanang wala pa'y tambal, or some types of bacteria po. So, again, that's for Bsc Class 3. Bsc Class 3 is not commonly seen in routine clinical laboratories like sa hospitals. Mostly makita na siya sa mga research facilities, like sa mga RITM, sa CDC, mga na nagtackle again og mga highly infectious na mga organisms, very highly infectious organisms. Again, that's for Bsc Class 3, highest level of protection and highly infectious microorganisms. Alright, that's for Bsc Class 3. And the last part for BSCs is again your summarized table. This is what I'm talking about from Bishop, na daghan pang classes, ang subclasses, ang BSCs. You have Class 1, Class 2A1, Class 2B1. So, mo differ lang siya sa airflow pattern, kaning velocity, checka. So, sa board exam usually, daw, ang gina-ask ay 70% recirculated air, unsa na siya na class. 30% recirculated, unsa na class, inana. So, again, this is not the main reference atong gibase for bacteriology. Okay, this is just additional. I just want you to be familiarized with it, or that para makabalo na mo. Kay once mabot mo review, like for boards na, what if mabalik ni siya, at least you already know. Okay, this is again from Bishop. Okay, your clinical chemistry na book. Okay, alright. So again, those are your BSCs. You have Class 1, Class 2, Class 3. Class 1 allows unsterilized air to go inside and then sterilize ng air na pagawas. Class 2, ang air padaan pasulod, gina-sterilize na, and then ang air pagawas also sterilized. And then ang Class 3 again is self-contained, closed na siya, alright, nanay gloves daan for highly infectious microorganisms. And of course, Class 2 is also known as your vertical laminar air flow na biosafety cabinet. Because again, the air inside the cabinet, they form sheets. Okay, they form sheets. Alright, okay, so that's for biosafety cabinet. Now, in the next video, we're now going to talk about the different biosafety levels. Okay.